Hi, I'm Cassie Angelo, and this is my case study 4. So the client description, so it's a 3-year-old female. Her diagnosis is autism spectrum disorder with a level 3. Communication is sign language, and she uses PECS. Her identified reinforcer is crunchy snacks, so pretzels, goldfish, Cheerios, and the behavior of concern is mouthing. So mouthing is defined as any instance where the client inserts inedible objects in her mouth and ingests, licks, or chews objects that are not edible. Some examples of this is Play-Doh, toys, crayons, dirt, leaves, and some non-examples are food and drinks. So we found that the function was automatic and sensory, so the client engages in mouthing behavior due to automatic reinforcement or sensory. Some response class items is ingesting dirt, licking toys, and chewing on leaves. So rule governed behavior intervention. So we used a sensory necklace. So the client was given her sensory necklace to wear around her neck for easy access and was told, if you do not mouth objects and instead use your sensory necklace, then you will receive a crunchy snack of your choosing. If you do engage in mouthing objects and do not use your sensory necklace, then you will not receive a crunchy snack of your choosing. So this intervention was selected to increase the desired behavior of utilizing her sensory necklace and decrease the undesired behavior of mouthing objects, and to keep the client safe from ingesting unwanted items. So how we use the sensory necklace. So some of the steps we did was that the sensory necklace was placed around the client's neck for easy access. The therapist reminded the client of the rules pertaining to the sensory necklace. The therapist provided frequent reminders to the client to utilize the sensory necklace. So things like, remember if you use your sensory necklace, if you need it. And the client received a piece of a crunchy snack of her choosing if she uses the sensory necklace, and did not receive a piece of a crunchy snack of her choosing if she did not use the sensory necklace. So the intervention outcome, so the sensory necklace was effective in reducing the client's mouthing behaviors. So the client showed high baseline levels of a frequency of 12. And then once the intervention was put into place, the client showed lower levels where the frequency was 4. So some of the intervention obstacles. So the reinforcer was not always motivating to the client. So the client became satiated on receiving a piece of a crunchy snack. So other identified reinforcers were utilized. So things like kinetic sand, nursery songs, bubbles, things like that, where the client had the opportunity to choose what she wanted to work for that day. And then the presentation of the sensory necklace was an obstacle. So what we did was the client did not always like having something around her neck, so she would frequently take it off and throw it across the room. So we instead presented it as a clip-on to her shirt, or we placed it on the desk in front of her to show her where it was for easy access.